Thanks, everybody. We have a lot of important information today, so we want to make sure that we capture everything that we can. Well, with that, why don't we get started? And what I would like to do first is welcome you all. This is our, gosh, I don't know, eighth learning community event so far for Exhale Cohort 2. And I want to walk you through the agenda because we do have quite a bit to cover today. So let me just share that screen with you. There we go. Can everybody see? Let me get it in slide mode. If I can, let's see. Can you see my screen, more or less?
Yes.
Can people see my screen? Okay. Okay, perfect. Let's get started with some very quick welcome introductions and agenda review. In terms of our welcomes, we have a couple of experts and folks joining us, some local funders that are interested in learning more about Exhale. So I want to just welcome and shout out to a few folks. Do we have Nikki Kamisinski on the line? Nikki, are you here today?
I am. Hi, everybody.
Great. Morning, Nikki. Thanks for joining us.
Morning.
And you'll be hearing lots more from Nikki later today. We also have Kara Reynolds and Bazan Lin from the Community Foundation of Greater Buffalo. Welcome, Kara and Lynn. If you're here, you want to do a little shout out?
Hi, good morning. This is Kara from Community Foundation. Lynn is not interested.
Welcome, Kara. We also have, I think, Christy King of the Senior Regional Collaborative, which is a Detroit-based organization that does a lot of excellent work with caregivers and older adults in the Southeast Michigan territory. And Christy, are you here today? I wasn't sure Christy would make it today or not. Well, you'll be meeting Christy into the future. And then we have our funders, of course, Ken Jenowick and Roxanne Cuevas and Misha. I think we have Amber Slixa and also Chris Lemon, Mary Clark. I think we have Tim Noyansenga from Michigan Health Endowment Fund. I believe we also have Shay from Blue Cross Blue Shield of Michigan, the health plan. And we're joined also by Dr. Myra Teta of Blue Cross Blue Shield of Michigan Foundation. So I'm thrilled to share that our ranks are growing. People are getting interested in learning more about Exhale. And today's an exciting day because we have a lot of interesting announcements about sustaining the financial viability and support for Exhale, into the future. We spent the last couple of years cultivating and building these programs, doing all the marketing, doing all the outreach, doing all the building, connecting with partners, connecting with community agencies, recruiting. Now you've built some really fabulous programs. So the next chapter of business here is to make sure that those fabulous programs find financing and sustaining opportunities to continue this good work into the future. And these opportunities are going to grow and evolve and no doubt change over time. But we want to use our learning community time going forward as a dedicated space to be able to talk about these issues, identify some new opportunities that might be coming down the pike, and just make sure everybody's informed. about where we might find funding and other resources to sustain the work of Exhale going forward. So in that spirit, what I'm going to do for the next 20 minutes or so is provide an overview. So you might remember many of you interviewed with George Washington University faculty and some staff members over the summer. There was a report that was generated and shared with the Wilson Foundation. I'm going to share some highlights from that report today, and we'll have a little discussion about it, just to let you know what they learned and what they are, identifying and recommending in terms of key considerations for Exhale financial sustainability. We didn't want to do that research without sharing it with you, and so today's the day that we'll do that. We're going to spend the majority of our time today having a conversation with Nikki Kimsinski, where we are going to talk about Western New York progress that's really being made toward the financial sustainability of Exhale respite and caregiver support services. We'll hear from Nikki about new opportunities with payers that have just emerged now in 2024. A little bit of a recap that she did a presentation about a week or two ago. We want to make sure everybody knows about this opportunity and how to access it. And Nikki can also say a little bit more about what is WINIAC, and just make sure you guys are all familiar with this great resource that we have in working with Nikki and WINIAC, and some new payer opportunities that have come our way through that relationship. Excuse me. And then she will also say a few words about New York's 1115 waiver and what might be some opportunities for Exhale coming through that funding stream, either now or in the future, but just a brief update on what's going on with 1115. And then we want to hear from all of you. I know that in addition to these policy opportunities, there are, have been many recent funding achievements by Exhale grantees and partners, earned grant opportunities, and also fee-based revenue opportunities. And we just want to give teams a chance to sort of do some shout outs and let us know what successes you've had recently, and what kind of funding streams are open. So we'll just spend a few minutes making sure that we don't, we're leaving no stone unturned and looking at not only the policy, but also the private funding and foundation funding opportunities that have been coming your way due to your own research and, perseverance of your teams finding these opportunities for Exhale sustainability and funding. So we're going to dedicate a whole hour to local, to Western New York funding. And then a few minutes of any updates, particularly from our funders who keep tabs on programs like CMS's Emerging Guide program that Nikki and Ken today can say just a few words about, and then any other broader emerging payer developments that either one of you want to, share in the spirit of, here's what we think is coming down the pike. And in the future, we'll spend more time on these state and national programs as they evolve, but just any highlights today of what's coming. And then in our final minutes, we'll, do some announcements, including, I want to spend some time, there's been some tremendously exciting achievements that this group of programs, these Exhale programs, have been able to garner in the last 6 months. And we don't want to let those moments go uncelebrated. So we'll do a little shout out at the end to make sure that everybody's up to date on some of the exciting conference and national awards and other cool things that have been happening due to the hard work of all our Excel grantees. So that's what we're going to do today in a nutshell. Any questions? Okay, great. I'm going to stop sharing that for now, and we'll jump right into the sharing of the GW. Let me see if I can find it here. Yes, I think this is it. Hang on. Can everybody see my screen here? Give me a thumbs up, somebody.
Yes.
Yeah, okay, perfect. All right, so we're going to spend a few minutes going through the George Washington University second study. So they did two studies. Let me dive right in. Exhale, the Family Caregiver Initiative, considerations for financial sustainability, findings from grantee and expert interviews. That consists of the part two. Part one, which I will get into. So this work was conducted by George Washington University's Fitzhugh Mullen Institute for Health Workforce Equity. It was done over the summer and the fall. And you might remember the lead authors were Margaret Zyman, Maria Castillo Ordaz, and Mandar Godas. You probably spoke with all three of them, most of you. So part one of GW's work with all of us earlier this year described the national landscape of policies and programs that are currently used to finance and reimburse respite services for caregivers of older adults. And the findings from this report, you may recall, were shared at the June 2023 Exhale Learning Community. So that was part one. And remember, Mandar did a presentation and Margaret did as well. So the second part of their research is getting summarized today. And I'm going to do a very quick summary of what they learned. They did some additional interviews and got additional input from Arch. They did interviews with most of the Excel grantees, as well as about a half a dozen state and national content experts to add to what they had already learned from the national study. So today you're getting kind of the whole enchilada. And part two of their research is trying to answer these questions. So number one, what are the key considerations for financial sustainability of respite service programs, and what factors really facilitate program funding? I think many of you know the answers to those questions, but we want to have some sharing and discussion. Number two, how do Exhale grantee program approaches and characteristics align with the factors that we'll have spoken about in question number one? What are the grantees' strengths and challenges as they relate to sustainability and financing? What have we learned, basically? Number three is implications of these findings for Excel grantees. What should we lift up? Four is implications of these findings for the funders and the broader philanthropic community for sustaining respite services for caregivers of older adults. So some of the key study takeaways, and the first one is not a surprise. Financing is a persistent challenge for respite providers. There's not enough public and private funding today to cover the need and the interest that's out there for respite. And there's also a lack of respite awareness among funders. So raising that awareness and raising the profile of funding availability is takeaway number one. Some factors that facilitate Exhal's and also just respite in general, financial sustainability include things like very important things like rigorous evaluation and data collection, strong program partnerships. GW feels that it's that having strong program partnerships, which all of you do, and it was a requirement of coming into Exhale that you enter into or leverage strong program partnerships so that you would have access to existing resources, infrastructure, outreach, and recruitment support in your communities that you could build upon as opposed to sort of starting from scratch. Other factors that facilitate financial sustainability include diversified funding sources. You need more than one. Flexibility and creativity in the pursuit of funding sources. So maybe you modify a program so that or tweak it a little bit so that it better fits a funder's profile for what they're looking for. And also the setting of targeted sustainability and financing goals is very important so that you A, have goals, and B, that you're working toward a set of funding sources that will give you the diversification you need and give you a broader range of places to go to or fall back upon in terms of having some diversified funding. GW, interestingly, came out and said direct asks at this moment in time to large health plans are not really a viable source of funding for many respite providers, including Exhale grantees. They believe that in time that will come, and I think we're starting to see through the work of WINIAC and others that time is coming. But thus far, knocking on the door of large payer XYZ, has not been the number one source of funding for successful respite providers. And, I think just saying that, acknowledging that, and working on that is something that we all need to do. Exhale programs reflect both the strengths and the challenges that are likely to affect their financial sustainability. So there's a lot of powerful things about Exhale, as well as some challenging things about Exhale that are going to influence your ability to get financing. And we want to kind of lift up and talk about some of those things today. A lot of words here, I apologize. So more key study takeaways include, so to maximize funding potential, GW thinks that Exhale teams should, again, implement those strong evaluation plans that you've developed together with NIAM. You're demonstrating evidence on the effectiveness of Exhale respite and the impact of respite on caregivers and older adults. Being able to make that demonstration is key to be able to show that you have evidence that your programs are working or having an impact on the lives of the people and the caregivers that you're trying to reach. You're also developing and leveraging strong program partnerships so that you can have access to local infrastructure, resources, referral networks, support networks for respite programming, and other kinds of caregiver supports. Those are all very critical, not only to respite, but also critical to creating networks of support and access for caregivers that create opportunities for them to feel like they're surrounded by a community that supports caregiving. Again, diversified funding streams was another major takeaway from GW's work, identifying sustainable priorities and key program attributes that have the highest likelihood of future financing. What are those things? And being open to program modifications that meet funders' needs and interests. So, for example, adopting evidence-based services that are reimbursable under various payer models, or models that address funders' areas of particular interest, like some funders are very interested in social isolation of older adults. Others are very interested in addressing depression in older adults. If those are priorities of the funders that you're talking with. Hello, could somebody please mute? Could everybody please mute? Thank you. So just the bottom line is, be aware and pay attention to what are those particular funder interests and needs as it relates to programmatic goals like decreasing depression and improving health in older adults, reducing social isolation. All of those things are often priorities for funders. And with Exhale and the robust evaluation design that our NIAM partners have created for Exhale, you can really come up with some great program data to address those issues very directly and speak to those issues. So making sure that you're taking advantage of those evaluation data collection opportunities, activities that you're already doing. And then lastly, the funders involved in Exhale can support the program and its financial sustainability by continuing into the future to do things like provide ongoing evaluation support or TA, expanded regional capacity for Exhale sustainability support and networking. So by that, I mean strengthening the capacity of organizations like WINIAC, like the Senior Regional Collaborative, to be able to play a role in helping Exhale partners work together, take advantage of the good evaluation data that they have at their fingertips, and forge meaningful relationships with local payers and others, including employers that are interested in seeing programs like Exhale succeed. Also helping organizations, again, like Senior Regional Collaborative, create opportunities for Exhale grantees and former grantees to continue to convene and collaborate. It's great to have a public working space where you can share ideas, you can share what's working and what's not working. And, you don't have to meet every other week. You can meet a couple of times a year. You can meet once a year, but some kind of an alumni network that creates opportunities for respite and for Exhale to share what's working in terms of funding viability and to collectively act on those opportunities. And then funders can play a really important role in elevating promising practices that promote respite funding and sustainability. One great example, the Arch's National Respite Sustainability Planning Framework provides a really good roadmap that I just want to make sure that everybody's aware of. Arch's sustainability framework identifies, important pillars and attributes, which they call diversified and leveraged resources for respite program sustainability and financing. Excel grantees and other respite providers can really actively seek these kinds of things out. And you've heard me say a few of these things already. So multiple funding sources, shared time, shared space, shared personnel, infrastructure, referral sources that are shared through local partnerships. Again, partnerships have been essential to the success of Exhale. Volunteer and faith-based respite service models have also been very key to the success of many respite programs in Exhale. Many of you have been very adept for years on how to identify and address community-based needs, such as rural health networks and others that, and that has really been a driver of success for your programs, not only in Exhale, but in other areas where you're able to understand and quickly tap in to what does my community need and how can I address it uniquely from my organization standpoint. Several of you have reached the maturation point of being eligible to apply for innovative and exemplary respite program and service providership. And I'm thrilled to announce again, I think I've said this 3 times now, but I'm very proud of this group and excited for them. Westfall Center for the Arts applied for innovative and exemplary respite program and service provider recognition, and they won a national recognition award for that status and designation. They were one of 4 organizations selected recently by Arch for this very prestigious award. So shout out to West Falls. It can be done. So, keep up the good work. Many of you have been chipping away at your Arch innovative and exemplary respite program activities. There are a set of guidelines that Arch wants you to walk through and make sure you've got in place to strengthen your programs. And as I mentioned, it can be done. And I want to congratulate Carolyn Panzica and Steve Harvey, who are no doubt on the call on that wonderful national achievement. So good job. And then, of course, pursue local funding initiatives. These opportunities do arise, and they're more, they're more accessible, they're more frequent. Local's good, national's great. Pursue sources of permanent funding. Examples of permanent funding can include things like getting included or inserted into annual town budgets. These may not be permanent, but long-term is pretty good. Also pursue WINIAC contracting opportunities with committed local payers. And I know Nikki will say more about that, so I won't spend time there, but state and national respite financing is another place where you can pursue more permanent funding as more funding streams like that begin to emerge. So I would say, the picture is definitely brightening. There are some challenges that you all noted in your interviews. One I'll highlight here is organizational capacity. Respite program capacity is limited by things like staffing constraints. Some programs were challenged and continue to be challenged to hire and retain program staff to be able to run, and support respite programs, and volunteers can be a great way to do that. And also just paying attention to your staffing planning, your long-range planning, just making sure you have a roadmap for staffing so that you can grow. Your programs can't grow if you don't have people if you're not able to greet people and open the door, and we need to have that infrastructural capacity to be able to run most respite programs, particularly if they're the social day model. So, building that capacity has been key. Some of you have been challenged by, and this is getting better as your programs are getting discovered, and that it will get better as time goes on, as more and more people hear about Exhale and respite. But small participant numbers and lack of program assessment rigor makes it hard in the beginning to collect that robust evaluation data that you need to demonstrate impact. So it's a little bit of a chicken and an egg, but as your numbers grow, your ability to collect data will grow, and your ability to demonstrate those impacts will grow. So keep at it. Those small numbers are usually due to things like people just don't know about the program yet, or it's getting off to a slower start. That limited staff capacity, recruitment challenges early on, and transportation barriers can also be challenging in the beginning, and making sure people have a way to get to your program. So transportation, if people feel that that's something we want to elevate to a higher level of programmatic conversation, let's just shout out at the end and see if we'll have a conversation about that in the not too distant future, because if it's affecting one or two of you, it's no doubt affecting more. So, this is a space where you can say, we need help in X. And if transportation is one of those things, please let us know. So, I would say now that we're in year 2, your programs have really begun, and we see this in Excel programs every time, and it's quite rewarding. And I want to make sure that that we see it, because you may not be seeing it yet, but it's coming. Now in year 2, Excel programs are finding ways to successfully navigate these and other program startup challenges, so that you can build key ingredients for program sustainability. And my last slide here, but what are those key ingredients according to GWU and all of you from the interviews they did? So one is, money alone is not enough to sustain a respite program. If there's other challenges with securing vital resources, namely staffing, you got to have staffing, you got to have program coordination, and having money helps secure it, but it's not the only answer to making sure that you are covered in that critical resource area. And then also planning for and implementing program budgets that accurately reflect staffing needs, and continuously assess staffing needs as your programs expand. So, your programs are going to evolve. Different levels of acuity of older adults are going to come and go. You're going to want to make sure that you're staffed and ready to be able to serve the people that are interested in coming to your program. Or if you cannot, just acknowledge that and more clearly define your target population. Also want to say that sustainable funding hinges on the ability to demonstrate evidence of impact. So make sure you're working with NIAM to get the good data that we know is out there on the impact of your programs. I want to also just mention that ARCH itself has a great library of evaluation and sustainability planning tools that are free, most of them. So, as time goes on, make sure you check in with ARCH to see what kind of tools and measurement supports and other kinds of resources could be available to your team through the vast library of support that ARCH is providing in this space. We talked about funder priorities a lot, so I'll leave that be. I want to mention quantitative and qualitative data is really important. Both types of data are powerful in different ways, and we strongly encourage you to collect both quantitative and qualitative data. And the NIAM evaluation and the caregiver intensity index evaluations give you the resources and the tools to be able to do that. Make sure you're using them and lifting them up because they really speak to people, particularly the qualitative piece. And then, leverage the resources that you've got here through Exhale. NIAM's a fabulous team of evaluation experts, and they will help you. Teresa is a fabulous facilitator and can help you gain access to caregiver feedback on any aspect of your program. NIAM and ARCH can also help you gain access to standardized tools and resources for evaluation that can help take you into the future. And a final note is make sure that you're integrating your Exhale respite services into, for those of you that are able to do this, into larger, more established service offerings within the grantee organizations, within your organizations, so that you can maintain respite services as as integrated programs as opposed to standalone programs. They will be more, they'll have, more legs to stand on, stronger legs to stand on if they are not, off by themselves. Integrate Exhale into your service provisions, particularly in the area of respite and beyond, older adult services and caregiver services. And then lastly, this is perhaps directed to the funders, but not exclusively. Engage employers. Employers are interested in the well-being of caregivers too. So make sure that they're hearing about the exciting improvements you've been able to make in the health and well-being of caregivers as a result of a program like Exhale, and elevate that at both regional, state, and national levels for things like advocacy and policy, so that can translate into future funding for programs like Exhale and other respite opportunities. So with that, that's really in a nutshell what GW highlighted in their lengthy second report. I want to stop and see if there's any, questions or comments. And if I can't answer them today, we'll follow up with the team and get back to you. But any thoughts, any, kind of burning feedback anybody wants to share? Any surprises? No, what a quiet group.
There was a question in the
Oh,
chat
in the chat. Thank you, Nikki.
if there was this report was going to be sent to everybody or a link to it.
I will need to check in on that. I do not know the answer to that. It was not something that TPI commissioned. It was commissioned by the funding team. Let me, I will get back to the group. It's a good question. Any other questions?
Lisa, this is Anne Marie. I was curious if GW's role at this point, based on this report, is now concluded, or was there any anticipation of maybe working directly with project initiatives to be able to see how best, with their expertise, to see how best we align in many different areas to be able to, best ensure sustainability and in working as well with our data folks, NIAM and Archangels?
Yeah, I think it's a good question, Anne Marie. I think what we want to try to achieve here is to, gain GW's knowledge of national policy and movements and understanding of what's going on nationally, and add that to what we know is going on locally that's actionable. That people like Christy King and Nikki Komasinski have been able to operate here in the regions on the ground. So to the extent that we can sort of bring this down to, so what does this mean to us or for us in Western New York and in Southeast Michigan? That's our goal, because, we think in the long run, that's where you're going to get your funding, at least initially. So that's kind of been our strategy. Number one is bring it local, and of course, learn from GW everything they've learned, and bring that back and into the mix as well. I don't know. Again, I need to check in with the funders about whether the GW team is or can be a TA resource going forward. I will certainly check into that question as well, and what that might look like. So we plan on having another learning community next June, the next one, also focused at least in part on the topic of financing Exhale. So by then I will, if not before then, have answers to those questions so that we know how and when and through what channels to follow up. But good question.
Thank you so much.
Of course. Any
Yeah.
other questions?
Yeah, this is Kaz Rodriguez from the Hispanic Heritage Council.
Hi, Kath.
Yeah, hi. First and foremost, thanks very much for the
Of
very
course.
presentation. And going back to the presentation question, the kickoff we had last week, there was a presentation there along with this one. If there's a possibility to getting or being have access to both of them, whether it be on online or whatever, that'd be very helpful. Okay, we have other folks within our organization that are very much interested in input as to the final product as it relates to the program as it relates to our organization. And I just want them to make sure that that they have the information as well.
Yeah. So I'm hearing that folks think it would be helpful to see the report and to maybe have access to, as many teams as possible that can help inform this.
Yeah, and that can be online or whatever. Go to a site, your site, whatever, to the information.
Okay, perfect.
Thank-
Yeah, and I'm also not entirely sure if GW is done, if their scope of work is complete. So we will circle the wagons on this and have another conversation about other resources in June. others, and then we gotta move on. All right, great. Well, thank you, everyone. Appreciate your interest and support this morning. Let's, I'm gonna stop sharing now, and we're gonna move into the part of the agenda where Nikki, thank you, Nikki, again for joining us today, is gonna hone in on Western New York progress towards financial sustainability of exhale respite and caregiver support services, starting with, a little bit of an update of, what is WINIAC, what is it doing? What is the exciting new opportunity that you guys have emerged for the Exhale programs in Western New York? So with that, let me please turn it over to Nikki Komasinski from the Western New York Integrated Care Collaborative. Hi, Nikki, welcome.
Lisa, thank you so much for having me, and I'm happy to give your poor voice a little break.
Thank you.
Hope you're feeling better. So hi, everybody. Some of this is going to be a little bit of a repeat from when I presented a couple weeks ago, but I've met with a few of your groups now, and I think hearing it a few times is going to be helpful. So I'm going to share screen here. So for those who don't know about Western New York Integrated Care Collaborative, my name is Nikki Kominski. I'm the executive director here. We are a community care hub for a network of community-based organizations, such as most of you guys. In our network, we have government agencies, but most of our network right now is nonprofit agencies. And our role in the network is to really be that administrative hub and to find sustainable opportunities for our community-based organizations to partner with clinical care and integrate that care. So there's really a whole person attention to healthcare. You can see the regions where we provide services as a network. The darker shaded counties are where most of our network members and the contracts and services are. And kind of flying through these slides, and definitely welcome to any questions you might have. But if you look at our community care hub model, we really sit at that intersection between community-based organizations and then our healthcare partners, and really act as that conduit of the contracting, the referrals, the negotiations, the sharing of data, the submitting of claims, and the billing. And our CBOs are the experts in delivering those services. And in this case, we're talking about, the exhale and the respite services, but it's so much more that is done at our CBO level. And then we help them with training, quality assurance, technical assistance, really all the things they need on the administrative side to really make these contracts and opportunities. The ultimate goal is that we all want to help improve the health and lives of the community. All right, so that's a very, 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 very quick overview of what we do. So I want to just jump into this opportunity that is here, and we really hope that we get to work with more of you. So we have at WINIAC, we have a contract with a Medicare Advantage plan, Independent Health, and they have contracted with us for what we're calling a caregiver support program. So the Independent Health member, what happens is the Independent Health member and their caregiver are teamed up with one of our caregiver support coaches. Those coaches are trained by WINIAC, and they, sorry for that. And they are staffed at one of our network member partner agencies. I believe I saw Healthy Community Alliance on the call today. They have a few coaches that are trained in providing that service. The coach and the member, they meet, and the caregiver meet up at the member's home, where the coach conducts a pretty, in-depth assessment, both of the members' social determinant of health needs and concerns, and the caregivers' needs and concerns, and where do they need support, what resources are they lacking. And again, shout out to HCA because they helped us develop that assessment based on the work they did here with the Exhale project. Once the assessment's done, then the coach works with the member and the caregiver, and it could just be working with the caregiver, just depending on that family's situation. But really to help link them to services, educate them on resources, help them set goals so that the caregiver is really set up for all the resources and services and training they need to be able to care for that loved one, keep them in their home, keep them with a good quality of life. Part of the program, aside from this kind of coaching and care coordination, is the part where the Exhale opportunity comes in, because the coach also can review a list of eligible evidence-based or evidence-informed group programs, which the member and or caregiver may participate in. And we invited Independent Health's team to listen to all your program descriptions when you guys presented. Was it last spring already, Lisa? Forget the date, maybe May. And we have convinced them to include the Exhale programs as part of these group programs, which can be reimbursed. So the coach reviews the list of all the different programs that are contracted with WINIAC that they can join, and they select which ones they want to do. They can enroll in more than one, and the health plan will pay for them to attend. So what the next, I'll get a little bit more into like what the services are, but basically it's your program that you've developed, but it definitely needs to be a little bit packaged. So when I meet with you individually as a team, your Exhale team, we talk about what is your program and how is it packaged to fit into what this reimbursement is. So the next steps you'll want to do is email me, basically, so we can have an individual meeting and really talk through what is your program, what happens, how can we fit it with this funding opportunity. Once we're contracted and go through that whole system, we onboard you, we provide you with training for and we really have kept the documentation piece to it very limited. You just have to send us, an attendance and an invoice, basically. But you'll also provide us monthly with starting dates of when, hey, we've got these programs started, so that the coaches have that list and can encourage them to sign up and join. So helps with your recruiting too, because we have the coaches constantly reviewing the list of who wants to attend. And then they help the caregiver and client enroll by sending a referral form, and then we send it to you guys. And you guys then take it from there. You reach out to the caregiver, confirm the enrollment, they attend your program, and then you submit an attendance and invoice to us, and then we reimburse you. So that's kind of the broad overview. The contract is basically for 2 units of service. So you guys would receive 1 unit of service for when the member or caregiver is enrolled and attends at least 1 session, and then 1 when they complete it. And the completion is where we're going to talk about what constitutes completion when we talk individually with each of your programs, because you're all different and all wonderful, and I love all the things you guys are developing. But we because they're all so different, we have to figure out, okay, how does your program fit in this contract? To, and that's kind of to Lisa's point where she was mentioning in the George Washington study that they released there. Sometimes you might have to tweak your program to fit into what the funder wants or is willing to pay for and things like that. So not big tweaks, but just how do we kind of package it so that it fits into this program. So I'm going to pause there because I know that was a lot of details. I kind of just wanted to do an overview because I just did this presentation to you guys all, most of you. But let me pause, stop sharing, see if there's questions before I do any. Okay, question from Steve. Is this Medicaid? No, this one is a Medicare Advantage plan, independent health Medicare Advantage. So we don't have that for Medicaid right now. Are there any other questions?
Nikki, I have a question. Based on your initial conversations that you've been having with the health plans and the Excel teams that have, stepped forward already, is there any information that you're finding is particularly important that we should lift up? Is there anything that, we're not covering that we should be? What have you learned from these first conversations that can help us continue on the path of growing this great opportunity?
Well, the few that I've met with, so with this opportunity, because there's an element of completion, there has to be a set number of, say, sessions or whatever. And some of the groups I met with, they have so many different opportunities, like 12 different sessions or different things, or maybe it's just ongoing, you can drop in whenever. And so we're talking about how do we package that into maybe groups of 4 sessions is one package. Because they can always come back and do it again. We want to make sure that the reimbursement works for, a set amount of sessions, and then we can figure out what that completion. It's usually around 2/3 or 3/4 of them, whatever the number of sessions are. And I don't want to get too deep in the woods of that, but just to kind of give you a sense that when the health plans are having, they want to have a start and an end date so they can say, okay, this is a unit of service or whatever. So those are type of things that we'll talk with you when I meet with you individually and go through what your package is doing. The other thing I would say is super important, which I'm excited you guys work with, NIAM and others, is collecting your data to show outcomes. Because this is just one health plan that we've had some success working this into a contract, but the more and more that we try to promote and propose contracting for your programs, we want to be able to show, wow, look at the outcomes and really not just attendance outcomes. You want to be looking at how did you improve the life of either the caregiver and or the member. And another element, I'm kind of shoving a lot out there, but how can you say that you provided education in some form? Now, it doesn't have to be that that's your whole program is that you're providing education, but could you have a resource list? And I was also thinking maybe across Exhale that maybe there could be like a Western New York resource list or in Eastern Michigan or whatever resource list that you guys just had as part of Exhale that could be on a side table, or you could email to caregivers or something that would be really great and help the caregiver because they would have links to maybe some of you already have that embedded it, but it would be great to see it across all the Exhale that there's an education option in there, something, just an idea that when I was talking, I think maybe with the group at Cradle Beach in Harmonia there, we were talking about that.
Yeah, that's very timely. We are speaking with Crowley Web Communications right now about creating like a master template that shows all the programs writ large. What are they offering? How do they differ? like an apples to
Yeah.
apples comparison, something like that would be helpful.
That's another thing that would be really helpful, but I'm talking about resources where the programs can link the caregivers to resources to help their member in the communities, right? So if
Okay.
it's transportation or if it's food or whatever, is there a centralized place that, you know, if somebody comes to one of their XP programs, they can link them to? Of course, there's always 211 and things like that, but sometimes it's nice to have a little handout or something at your programs that you can share with people. Keep something worthwhile, I think, for the Exhale teams.
Okay.
Misha has her hand up.
Hey, Nikki. I just wanted to ask a clarifying question, and around tracking outcomes. So for this opportunity, is the plan considering caregivers as members, and or the older adult they care for as the member, or
That's a
just the
great
older adult?
question. That's an awesome question. So in this opportunity, the member that's the loved one being cared for is the member of independent health. However, the caregiver can participate in the whole thing and even go to the workshops or the Exhale programs without the member. So independent health's a lot like paying for the caregiver of their member to receive all these supports because they understand that if you support the caregiver, then the loved one gonna hopefully have better health and get cared for in their home and be less likely to have hospital visits and have to be placed in a nursing home or something. So yeah, great question. So the caregiver it doesn't matter who the caregiver has for their insurance. And the member, though, does sign off on the very first meeting with the coach, like an authorization form that it's okay for the caregiver and the coach to work together. Without them, they don't even have to be in the room. Any other questions? I am going to put my email in the chat so people can reach out to me directly.
Great. Thank you.
And then, oops, that's not the right email. Did you want me to briefly just touch on the waiver real quick?
Yeah, I mean, unless there's any other questions for you about Western New York opportunity or anything else on that, and then we can, yes, definitely dive
Okay.
into the waiver.
Okay, I'm doing a really brief overview because it's not directly that I've seen the respite services aren't necessarily covered, but a lot of your organizations work with Medicaid members and might be interested in participating in this. So it's been like a 2-year process with this waiver that we've been talking about it. And it's finally here. So the Centers for Medicare and Medicaid approved the New York State waiver. This is a demonstration project, $6.6 billion to New York State. And the funding is really earmarked for services addressing health-related social needs. You can see the delivery of services, $3.14 billion over the course of this 3 years. And then there's also funding for this health-related social needs infrastructure. And the regions in Western New York, I know a lot of you might be also Finger Lakes, and of course, I apologize to the Michigan folks. I won't be too long on this. I just want to make sure everybody's aware in New York, because this is huge. This is transformational funding for community-based organizations that are delivering services addressing health-related social needs. So our region will receive 36 million to really boost up this infrastructure, bring it together as a network. Other funding through this waiver is for a statewide regional organization, Health Equity, to kind of do seems like they're going to be doing reports and analysis on and working with the different regions. But there's also a hospital funding for New York City hospitals. And then really exciting, there's this workforce funding. And the social care agencies are mentioned that might be eligible for that funding. So we're going to keep an eye on that. Ultimately, for the Medicaid member, they want to scale up the delivery of these services for improved access. They want to have reliable and timely referrals of member to social care services, seamless tracking. So there's going to be a lot of focus on how data integrates with from what social care services provide, like food, housing, transportation, how it's all documented and then connected to the member's clinical record. So there really can be a holistic record of what a member is receiving and how their care is going. And then improve collaboration between community-based organizations, the healthcare organizations, and then other partners like government, family supports, jails and prisons, like all together. So one of the big funding under this health-related social need infrastructure is the formation of these social care networks across each region. There's 9 regions, and one of them is New York City, so there'll be 4 additional down there. But in Western New York, the 4 counties included there are Erie, Niagara, Cattaraugus, and Chautauqua. And then for those of you in the Finger Lakes region, Allegheny, Orleans, Wyoming, Genesee, and then about 14 counties all around the Finger Lakes are in the Finger Lakes region. Western New York Integrated Care Collaborative is looking to apply as the social care network lead entity for this Western New York region. And our application is due on March 27th. There are 412,000 members, Medicaid members in the Western New York region. We are seeking partners, and you can email us if you think that your agency might want to deliver some of these services. And I'm going to just briefly review the services, but I also want to let you know that as we plan, we have 5 pillars we're really focused on to make sure that what we're planning is going to work for our region. We want to make sure it's consumer-centered. So we want to hear from consumers involved in the planning. How's the workflow going to work for them? Screening, how do they want the services delivered? We're trying to be transparent in everything we're planning. There's information on our website. You can go, we have a tab right there. We always receive a lot of input from our CBOs, just the nature of our network being all CBOs. But we have regular forums that we're talking about it. If you'd like to come to one of our forums, like I said, just email me and we'll get you on the list. We're trying to be collaborative across all stakeholders, providers, health plans, CBOs, consumers, and any other stakeholders, data folks. And we really want it to be focused on making sure we're tracking and measuring the programs and services to ensure that we can show New York State that funding in CBOs and health-related social needs is a good investment for the community, for the state. This one just talks about what as the social care network lead entity will be responsible for. And then here's some of the health-related social needs and the eligibility criteria for receiving those. So there'll be 2 levels. I promise I only have this one and one more slide, and then you can ask all the questions. But so level 1 will be any Medicaid member. The state ideally would like every single one of those 412,000 people in our region to be screened for health-related social needs. They've determined the tool, the ACH, Social Determinants of Health screening tool. And so that's level 1. And then depending on the screening, if the member has a Medicaid managed care plan, like Fidelis or Amerigroup or Molina or Independent Health or one of a Medicaid managed care, and they screen positive for health-related social needs, and they have fall in one of these buckets here, then they are eligible for these enhanced services: housing supports, transportation, enhanced care management, food, and nutrition. If they don't have all three of these, but they do have a health-related social need, they can go into navigation services to link them to services, okay? So these are the health-related, the enhanced services. And a little more detail, we don't have all the scopes of services to say, or the payment schedules or anything like that. But if your agency provides any of these services, we want to hear from you. We want to know, like, who do you serve? How many do you serve? What capacity do you have? Because there's also part of that health-related infrastructure funding is capacity building funding for the CBOs. So do you need staff in order to help cover these services? Do you need an extra refrigerator if you're doing, food programs? Do you need computers for the new staff? Do you need trainings? What do you need? So that's just the brief overview, but I'm going to stop there, see if there's any questions. But also I really encourage just email us if you want to be invited to any of the upcoming work groups or lunch and learns where we go kind of deeper dive and really trying to get the input from as many of our community to help inform our application. So any questions?
Nikki, it's Anne Marie Orlowski from Cradle Beach. Thank you for that review. My question is, given the nature of the long list of substance, mental health, developmental disabilities, so on, and foster care, is it fair to say that this waiver is working across all the O's, right, all the offices, in order to be working in partnership relevant to this, these opportunities and these services? So often and many of us, I think, on this call fit in between, right, a number of different O's, so to speak,
Yeah.
right, the office of the O's. And I wanted to just clarify that, in fact, this is integrating all of them together towards a solution and better services.
Yeah, I like to be positive and think it will. Those were the same questions. We had to submit a list of questions by the 31st of January, and that was pretty much one of our questions. What if they're already getting services through a health home or through the other offices, Office of Mental Health, for example, or something like that? How is the state going to give us guidance around that? So, good question, because we had the same one.
Yeah,
Not
thank you.
sure how they're going to do it, but it's something that I'm hearing through the state forums that I sit on of other community care hubs like ours asking similar questions.
Yeah, it's long overdue. Thank you.
Yeah. Any other questions on either the opportunity to participate or the waiver? All right. Well, I'm always available at the email. So hope to hear from a bunch of you, and I'm going to pass it on to you, Lisa.
Thank you so much, Nikki. Very valuable information. So will there be regional applications? Is the state sort of looking at this, territorial, geography by geography? Is that the plan?
Yes, there's 9 regions. Yep.
Okay,
Mm-hmm.
great. Well, it sounds like Western New York is, lining itself up to be competitive. And lots of good things to think about today. So Nikki, are you guys developing like a working group to put together your application?
Yeah, we have several work groups that we are seeking input from. We have tomorrow there's a health-related social needs work group. I think by the end of this meeting, I'll put it in the chat what time it is. I know it's tomorrow. Well, but that'll be another one in 2 weeks if you can't make tomorrow. Because we just really are trying to hear from the folks that are already delivering these services. How are you already getting referrals? How are you already tracking what you do? And what would you need if you were going to increase capacity to deliver these services? What are your capacity needs? So yep, that's tomorrow. And then on the 16th, it's a Friday, we're having a community advisory work group. And we're really encouraging folks from all different stakeholders. I hope to have some Medicaid consumers on there to talk through the workflows, really get people's comments and thoughts on like what would be, we really want it to be seamless for the consumer. We want it to work for providers who have a lot of screening requirements already, for the MCOs, which are the health plans, and really for the CBOs. This is transformational funding for folks that deliver these services. So we want to make sure that their workflows are gonna, work for them and not be an afterthought. So hopefully you guys can meet us at some of those work groups. And I'll, again, if you send us an email, I'll send you the calendar link, but I will put the dates and times in the chat while the next presenter is speaking.
Thanks, Nikki. That's great,
Sure.
because that gives people an actionable opportunity to get engaged and help inform your work and hopefully help our region come out with a good supportive plan.
Thanks,
Great.
Lisa.
All right, fantastic. Let's see. Is there so one other area that has been rewarding to see and very interesting, especially in the last 6 months as your EXO programs have launched and gotten off the ground, is, you're all beginning to find some of those funding opportunities and achievements, including things like even fee-based revenue activities that you've started to get underway. And this is true not only in Western New York, but also in Michigan, we're seeing. So why don't you just give people a chance to shout out and talk a little bit about like what other funding opportunities have you found in the last 6 months that have been something you've acted upon, something that piqued your interest? Like to just get a sense of how you guys are going about thinking about and learning about other funding and sustainability opportunities, in addition to the kinds of policy things we've been hearing about today. I know a number of you, I don't want to put anyone on the spot, but, I know a number of you have had some successful grant applications recently. Tell us, just shout out what's going on, what's been working, maybe what hasn't been working. Steve, you're always up to something. You got any up?
That's why.
Yeah, we're applying to a couple of the grants, and we're finding more and more opportunities, which is a good thing. We just recently got one from the New York State Council of the Arts to expand the Musical Memories Cafe and do some enhancements to it. So, and we've got about 2 or 3 out there. So, lots of opportunities.
And how do you do that, Steve? How do you find them?
I use Grant Watch and Grant Station. So that helps with some of the foundations. I think you have a better chance with local ones. But we found a couple opportunities through that. Lisa, you've been a great resource as well.
Thank you.
And then we do keep an eye on the state, although the state is, not the best place to find funding for this kind of program that I found. But I think it's about staying creative, and as Nikki said, it's connecting to connecting the caregivers to resources. So and when you can demonstrate that, and and then the caregivers are able to respond to that, I think that's what we did. We demonstrate that we connected them to resources, and then we demonstrated a decrease in anxiety. And I think that's one of the reasons why we were able to secure that recognition from ART. And I think a lot of programs can do that, but some programs forget that demonstration of impact is really huge. So for us, that's been a big part in driving our success in grants.
That's great.
Lisa?
Yes,
Hi, I would also add to what Steve said, I've had success just with some suggestions from our participants for support from community organizations and faith-based organizations, and places that they attend themselves and they attend our program, and they have suggested to apply to smaller amounts of money for local organizations, and that's done well for us too.
thank you, Carolyn. Appreciate that. And what about, in Michigan, I know some of you have had some success with programs where you're charging, small amounts of, I don't want to say fee for service, but, fee-based types of opportunities. Have those borne out to be something that you think would be worth continuing? What are you learning from what you've piloted with some of these programs? Any comments from our Michigan teams today along those lines, or funding opportunities you found? Or anybody, I'm not picking on Michigan. So am I hearing that that's not been a really viable avenue for trying to earn some, if you slice the pie of revenue that's coming in, is it a very small piece of the pie? Sounds like it. Teresa, are you speaking? I looks like you might be trying to say something. Teresa Lawrence, you're on mute. Oh, well. Teresa, you're on mute. Are you trying to say something here? Maybe not. She's deep in thought. Well, I mean, this topic is one of those evergreen kinds of things. We welcome any news and information about, what's working. What kinds of programs like Mother Cabrini or other kinds of perhaps statewide programs have been panning out for Excel teams, beyond the local reaches of the work that WINIAC and Senior Regional Collaborative might be doing. Always of interest to hear what's working for people and what hasn't worked. So let's just keep this sort of a running commentary. Sharing this information through the evaluation is another way of helping to make sure that we capture what kinds of pursuits of revenue have been successful for all of you. Because at the end of the day, we want to understand, did we increase the supply of respite opportunities for caregivers, and how are we going to sustain those? So, answers to those questions through our evaluation process are very valuable to this program and to others that will come down the path in terms of, being next and looking for funding and sustainability for Excel programs. So please keep up the good thinking and welcome any ideas that people have at any time. Let's see. So in terms of Anything else we want to say about national programs? Ken or Nikki, like in particular, anything you want to say about, what is the guide program, just for a sneak preview of what that might be about? We can certainly talk about that at a future date if we feel we don't know enough. But there are some national funding opportunities that are kind of more piloty, or test pilot in nature. If any of our knowledgeable funders that keep tabs of these policy opportunities want to say a sentence or two about what you see might be coming down the path, we would welcome anything you guys want to share.
I could just provide just some real quick updates on what we know is happening at the
Thanks,
federal
Ken.
and state levels, just around caregiving in older adults that may not have immediate opportunity for funding right now, but I think that we're learning more. And one of the great things about this learning collaborative is that when opportunities are there, they are shared. And I thought I could just run through a couple just so the group here knows about it. I know Nikki could share a little bit, as well. But yeah, I mean, there's a lot happening around family caregivers, as I'm sure a lot of you know. In 2020, there was a national strategy to support caregivers that was launched, which is a 5-year national strategy that was developed by the previous administration. And I think many of you know that President Biden has put a lot of support around family caregiving as well. And so, we're seeing that there's a lot of, federally funded initiatives that can come, that are coming or will be coming as a part of that. And many of you may know as well that this is a big year for the Older Americans Act that was reauthorized in 2020 and is up for reauthorization this year. And for our Office for the AAA friends, know more than anyone, how important that is for aging services. So, it's important enough for our foundations and for the aging, or foundations that focus on aging services that are supporting an initiative in partnership with the grant makers and aging grant makers of health to really advocate for the reauthorization of the Older Americans Act. And so that's just an important piece that we hope will lead to additional funding opportunities that can make their way into all of our communities. There's also an initiative that's happening across 10 different states in the country that includes New York and Michigan, called Changing the Care Conversation, where I know Misha, the Wilson Foundation, our foundation, I think some other foundations that are on this call are supporting statewide coalitions to increase their advocacy, and the ability to advocate for and discuss critical issues for caregivers, that are bringing this attention further to light for services. A couple other things that that Lisa, that you mentioned. There's a 2024 Medicare physician fee schedule, as well as the guide model that is directing Medicare reimbursement for for services that benefit older adults and caregivers. And Nikki, I don't know if you want to share just what you know about that. I will say, I believe that what's unique about the guide model, caregivers are actually the covered benefit in this to a part. Going back to what Misha had asked earlier, which I'm pretty excited because that's pretty unique when you see services that are being covered and reimbursed that actually have the the caregiver in mind as far as coverage and data. But did you want to share just your thoughts on those?
Yeah, thanks, Ken. So as far as the guide model, it's very exciting because it's basically a provider groups are able to apply to to deliver this guide model, and they get a lot of training and technical assistance from the federal government on how to align services for caregivers and partner with community-based organizations delivering services like caregiver training and caregiver respite, things like that. So we're going to keep an eye on that, see if there's any guide model provider groups in our region and talk to them about, hey, look at this. We have a whole network of respite providers. So more to come on that one. And then as far as Ken mentioned the 2024 physician fee schedule for Medicare. So this Centers for Medicare and Medicaid, they every year they send out this physician fee schedule, and this year they added some new billing codes. Billing codes are really important for being able to partner with health plans because it gives the health plan a pathway to pay for these services. There's some more new billing codes, and this time one is called Community Health Integration Services, CHI. The other one is Principal Illness Navigation, and respite can fit into those. Western New York Integrated Care Collaborative was accepted onto a national health equity learning collaborative to learn how to partner with clinical providers. We have Catholic Health, who's big provider and hospital system in our region. That's our clinical partner. We're attending these national forums on how to bill for these, how to partner together. So as that pilot comes about, we'll have more to share with you all and learn how, because these are brand new. No one in the nation knows how to do this partnership yet. And we are receiving direct training from national experts on what CMS envisions for these codes, like how do we document from the provider to the CBO, all the different intricacies. We're going to figure it all out first and then bring it to you for opportunities as they come about. So very exciting stuff happening. So you guys are on the forefront. We're also mentioning you guys. I met with US Aging has an Aging and Disability Business Institute, which if you don't know about them, I would kind of type that in your Google search. They have so many resources. But anyway, they have a whole caregiver department, and they invited us to be on their Caregiver Advisory Council, which is, I think this week is the first meeting. So as we learn more there, we'll be sharing it down with all of you to see how your Exhale programs, but I've met with them, shared all the great work you guys are doing. They're all so excited, that this work is being incubated in Michigan and New York, and really, so as they provide some more opportunities, we'll be sharing it with you guys.
That's great. And then for both of these programs that Ken and Nikki spoke about, what's the timeline? I mean, they're like multi-year pilots though, right? I mean, they're
For the timeline for the physician fee schedule, it's now in the physician fee schedule. It is a covered benefit for Medicare fee-for-service members.
great.
Providers are learning how they can bill for it and deliver it and partner with CBOs. And then whenever Medicare puts it into the original Medicare physician fee schedule, Medicare Advantage eventually has to provide all those services. So all the Medicare Advantage plans are going to need to be providing it as well. So we're trying to stand up a pilot with Catholic Health, get some outcomes, and then take it to the Medicare Advantage plans and say, hey, look at our model. Here's what we can do. Let's contract and partner and bring more opportunities.
Okay.
Yep.
Terrific.
Yeah.
Medicare Advantage.
Lisa, I want to thank you for.
All right, great. Well, that's super promising.
Oh,
And,
hey, Lisa, Ken had something else.
Yeah, I just want to say, I want to thank Tim Naisenga from the Michigan Health Foundation who put a link in that provides more information about the
And
Ken,
not a problem. Can you? Hey, Lisa, can you hear me?
Not great. Please speak up a little bit. Is that Tim?
Yeah, hey Lisa. Yeah,
Oh,
it's
hi,
me.
Tim. How you
Yeah, I
doing?
don't know if you guys can hear me. Sorry, apologies.
Yes,
Yeah,
no worries.
as Ken mentioned, I threw the link and slides into the chat. But I think is Nikki kind of adding on to what a little bit of Nikki mentioned. I know in a couple of the webinars I've gotten a chance to. It sounds like there's also opportunities to sort of integrate because there's billable codes for community health workers who can also provide education. So if you are a community-based organization that have community health workers and really kind of figuring out how that links to providing the education part of the respite, like I think Nikki kind of alluded to her, there could be a potential good tie-in as well. I'm pretty excited about this opportunity because to me, it really sort of starts opening up the doors to sort of this like reimbursable services that between healthcare providers, health plans to community-based services as to where, so I think this was sort of like the nut we've been trying to kind of crack for a while. So to start seeing this thing opening up a little bit is really exciting. And for this group to be situated in a position it is to potentially leverage that is also exciting. So great stuff. And anyway, always glad to see Nikki on the call and just kind of hear all the great things you guys are doing as well.
Yeah, Tim, I wanted to echo that. I mean, and to think that as Nikki and I got a chance to chat about this yesterday. There's also the master plan for aging that's being built out in New York State. That, as you can imagine, caregivers follow it, and respite being a very central theme in so much what we're being built out. The plan itself is this is the first draft coming out in July. That's a plan that will be going to our governor, to build out, but serving on a few of the different subcommittees and that, respite and certainly the work of Exhale is being highlighted, in that. So the important thing is we just wanted to share is, there's a lot that's happening right now, and some of it's directly related to caregiving. Other opportunities are more, capacity building around, network hubs and aging services. And, as we learn more information about ways that, that caregiver services can be integrated, built out, as a network and as, and as Exhale grantees, we'll be sure, and we really try to share that, and I guess if you can tell in real time, as you learn about it.
Yeah, and it's great that Exhale is so well positioned with, with knowledgeable people, with teams that are practicing in the field and learning direct from caregivers, and our wonderful funders that are keeping a finger on the pulse of all this work that's going on both in Michigan and in New York and nationally. So I think we're well positioned to really help inform a lot of this work going forward. So I want to thank everybody for chiming in today, sharing what you know, and let's just keep doing it, because I think these opportunities are just beginning, not ending. So this is great. All right, in the time we have left, I want to do a couple things, just a few quick announcements. For Exhale grantees, the next round of narrative and financial reports for your Exhale grants will be due Friday, March 1st. I will be sending out today, hopefully maybe tomorrow, the template for the narrative report. And as always, you can use your grant budget template to modify and update your spending for your financial reports. So those, I think this will be your fifth or sixth. Those will be due March 1. If you have any questions when you see the narrative or any questions at all, my door is always open, so feel free to reach out. The next learning community meeting that we have is June 18, virtual, again, like this one, from 9 to 11. And I think what we are looking at for possible agenda items, there is some more discussion around sustainability, following up on some of the good questions that emerged today, and learning more about what you all are learning in the next couple of months from all the good collaborative work that's going on. And then also some, many teams, and this is an evergreen topic, marketing and identifying caregivers to participate in exhale respite programs continues to be something that we all need to work on and do work on in exhale from the minute you open your doors. It's an evergreen topic. So I think we will spend some time at our next learning community talking about marketing again from a standpoint of what's been working, what kinds of referral and relationship opportunities in your regions have you found most helpful? What agencies have been most fruitful in terms of providing you with go-to places to identify caregivers of older adults? So we'll tee up some discussion around that. So please be giving it some thought, like what's been working around referrals, and where are you finding the most caregivers? Many of you share with me that word of mouth is really, the number one thing. And that's great. And I'm sure there's other things that you're learning too. So let's just keep thinking about that topic. And also, what would be helpful in terms of topics for upcoming learning communities? Anything else we think is, sort of critically important that we want to make sure we talk about on June 18? You don't have to answer immediately. You can think about it, send me an email, but always want to invite that topic. Let us know what you'd like to talk about at these meetings, and we will do our best to respond and make sure that we're providing you with hot off the press program information and resources that will help you do the good work that you're doing. So,
Hey, Lisa,
yes,
I was wondering
Diane.
it might be an interesting topic around any ethical dilemmas programs are facing, any challenging scenarios they're running into that, peer support may be helpful. I don't know if that's something that, this collaborative could foster for the groups, or if other grantees have run into situations that they are just wanting to bounce off of peers. I know, we've had some scenarios where we've had a loved one pass and are thinking about, ways to reach back out to that caregiver, things like that too. Or, the ethical dilemmas of, trying to respect someone's autonomy and independence and providing dignity to the loved one, but also supporting that caregiver.
Yeah, thank you, Anne. That's a good and sensitive question. We will definitely add that. So folks, be thinking about that as well. Anything that's been on your mind, not quite sure how to ask, or, hasn't come up yet. This is a great venue for that type of conversation as well.
Lisa, I just wanted to mention, I'm not sure if it impacts other organizations within our Western New York or Erie County region, but our local United Way Day of Caring, which is kind of an all-day event, being held on Tuesday, June 18th. So for any organizations who are heavily involved in that, Cradle Beach, we typically end up, getting anywhere from 100 to 200 volunteers that day. So that it may be a difficult day for us, but we'll try to have somebody be present. But just in case it affects any other organizations, just so you're aware.
Okay, thank you for letting us know. And then Also want to just shout out that recently a number of us heard the fabulous, excuse me, fabulous news that the Arch National Conference, which is going to be held this year in Albany, New York, from May 21 to 23, has identified many of you all, and our team submitted proposals to do a session on what is Exhale. So there's a couple of sessions that were proposed that I'm aware of, and a bunch that Arch has identified that they'd like for us to present, to share nationally with the National Respite Network that Arch has created, and to really help get the word out about what is Exhale. And it's super exciting to have Arch put a spotlight on the work that you all are doing here in Exhale. And I'll just identify a few that I'm aware of and invite anyone to shout out if there's others. So I know that myself and Linda, and together with the HCA team, will be providing an overview of what is Exhale and what are we evaluating in Exhale? What are we learning through that evaluation? And in particular, HCA has been doing some fabulous work by learning from the caregivers that are participating in their Exhale and coaching programs. So we're planning on sharing with you a panel of caregiver speakers that can, like a moderated panel of speakers that can talk about their experience working with the Caregiver Tech Solutions program. You'll learn about the coaching opportunities that come with that program, that that now WINIAC has been able to secure reimbursement for that coaching activity, and what kinds of things are caregivers doing with the technology and the coaching support and services that they're receiving through Exhale. So one of our online programs, HCA's Caregiver Tech Solutions, will be spotlighted nationally through this conference. Another program, again, shout out to Steve and Carolyn for innovative and exemplary respite services that they have been awarded that status. They will be given an opportunity to provide a presentation and also a Steve, help me know all the details of what you guys are going to be doing. So there'll be a presentation.
Yeah, so I think,
Yeah. Go ahead.
so I think there's three. Yeah, it's three things. So I think we have a breakout session from the award, the recognition. We also got accepted to present on the program to give a more detailed overview of what we have accomplished, the evaluation, the outcomes. And then
Great.
for those that are interested in that come to it, we also are having a table of the exhibitors.
That's fabulous. So, you know, for your program, that's a really nice national platform. So well timed with sort of the culmination of your grant activities in that space and the launch of your program's ability to offer, you know, replicatable, fundable services in respite. It's just beautifully timed for you guys to showcase your program and to start doing some of that state and national marketing that I know you want to do. So congrats on that. And again, the timing, I think, really could not be better.
Totally agree.
I think there are other programs too that were identified. Daisy, you're going to be speaking about the Buffalo Federation of Neighborhood Centers has been chosen to speak about a program that I think is an immediate precursor to Exhale and has been very influential in the design and delivery of Exhale. I don't want to get in over my head here in terms of exactly what Arch has asked you guys to speak on, but if Daisy, if you're on the call, you want to say a little bit, please shout out.
Good morning, everyone. Thank you so much, Lisa. Yes, we're happy to have been selected to present our project with a focus of providing caregiver support services in partnership with faith-based ministries and organizations and other senior service providers in Erie County, with a primary focus in communities of color to provide more access points to caregiver support for communities of color, and we're very excited to have been selected.
Yeah, that's really wonderful. Congratulations. Anybody else? Linda, is there anything else you guys are doing around the Arch conference that we hadn't talked about yet?
No, we look forward to presenting with you with nothing else.
Yeah, so we all have a little bit of work to do in terms of getting our PowerPoints all polished up and ready to go. But I just wanted to say I am like super proud of the work that you all have done and very impressed with how far you've taken these programs in a short time and during a challenging time when the whole world has been dealing with COVID and other, wide array of challenges facing our communities. And to have that kind of national recognition of an area that has not had that kind of national recognition is just wonderful to see and quite rewarding. And I want to thank you all for your hard work. And it will be fun to see you all, or hopefully many of you in Albany. We should try to do some sort of a Exhale gathering or happy hour or something like that. While we're all together in Albany. Anything else happening around the Arch conference? Doris, is there anything I missed? I know you're always very integral in getting these things happening. Doris Green, did I miss anything here? Guess not. All right. Archangels, I want to give these both Isel and Sarah a chance to answer any questions. So over the weekend, and I apologize for over the weekend, but I want to make sure everybody gets this information in a timely way. I sent out an opportunity for Exhale teams to sign on to participate in a research study that's being conducted by Archangels and its Caregiver Intensity Index together with University of Pennsylvania. And I'm going to stop there and let either Isel or Sarah say a sentence or two about what is this study? What are the benefits to both teams and caregivers for participating in this study? There is there's stipend opportunity as well as field learning opportunity that I think is pretty exciting and important. So I want to give you guys a couple of minutes to sort of give it a plug and make sure everybody has an understanding of what we're offering here and how to follow up. So Sarah or Isel, would you like to take the floor?
Hi, it's Isel.
Hi,
Archangels. It's thank you so much, Lisa, for allowing us to plug this. This is a research study that actually came out of a question from Ralph C. Wilson, which is, everybody and their cat is developing all these mobile apps, but how do we know an app is worth investing in? What do caregivers really look for or need from a mobile application, and specifically around managing finances? for themselves, for their loved one. So it's really trying to get at what is that criteria that a caregiver uses in making a decision on whether an application is helpful or not to them. After conducting several focus groups, like lots of focus groups, and some of you even had your caregivers participate in those, we now have the criteria set, and this is the final stage. We're not this is not a focus group. It would literally be going online and answering questions in a survey format. We're specifically looking for caregivers who have experience with using a mobile app. And if they're using one to manage their finances for themselves or their loved one, even better. What's in it for you in helping us is that we are offering $1,000 per site in helping us recruit. And we're looking for about 10 caregivers per site. You don't have to be part of XCal, because I know that there's several organizations on here that are not. But it is literally if it takes 10 minutes, it might be too long of going through the questions on the survey, asking specific questions about an app. So I'm going to stop there and answer any questions. I hope that was a good overview.
Yes, thank you, Isel. So look in your inboxes, maybe first thing this morning, you saw an email from me that describes this opportunity, an email that you can send out, team leaders, to caregivers that you identify as potentially interested in this opportunity. And then like a little flyer of information about what is this study and why is it important. So that's the little package that Isel and her team have put together to help you make this easy to do, easy to participate in. And if you have any questions, your best go-tos for this are Isel and Sarah. You know, they're the most sort of directly engaged working with the Penn team. I think I see a question from Karen. Karen, do you have a question? Karen, do you have your hand raised? Karen from Buffalo. Maybe not. Oh, okay, sorry.
I will be conducting follow-up with the email list that Lisa sent out. So I will be reaching out to you probably later today, maybe tomorrow, to gauge your interest on it and to answer any and all questions that you might have.
Thank you, Isel. Appreciate that.
And I put my email in the chat. So if you have a question directly for me or want to just email, just go ahead.
Awesome. Wonderful. And it's great to be at the cutting edge of research on respite and caregiver supports in addition to respite programming. So thank you, Exhale, for all the fabulous work you're doing. We're at 11:01, so it's time to call it quits for today. But we look forward to seeing you in June at the next Learning Community meeting. My door is always open. Thank you, everybody, and have a fabulous day. Go Exhale.
Thank you.
And thank you to all our speakers today. Very valuable information.
Thank you very much, Lisa.
Yes. Nikki, thank you.